Yes, we are live. Hello,
Hello,
everyone.
hi
So today we have two
everyone.
new faces. Okay, today we have two new faces. One is our Chen Yi, COO, and one is our Kim from one TCM, a very rare speaker. Okay, Chen Yi,
Yeah.
your mic
So
pass to you.
yeah. So basically, this is still our second session for in June that whereby we're going to cover women's health, and today's topic is going to be urinary incontinence. I'm sure we have been hearing it like it will only happen like among the elderlies, but today we're going to tell everyone that this is may not be the case. So I'm so glad that today we're going to have Ben and Sukim to share with us on the details. Now, if you guys just have a quick look over here, yeah, as you can see that actually more than 75 or to 80% that are actually the sufferer are actually women. And we can see that women have this urinary incontinence higher rate than men. And most of the major causes is actually due to the pregnancy, the menopause, childbirth, obesities, and also medications. Now, we also notice that women tends to wait longer to get their diagnosis, which is like 6.5 years. This is
Very
a
long.
little bit, yeah, a little bit too long to get it. And imagine the sufferers worldwide is more than 200 million people. So now I think we shouldn't be waiting for too long. Let's
I think
get
one of the reason people waited long because they don't know that incontinence can be treated.
yeah.
Yeah, one of the
So
reason. Mm.
so maybe I will let Ben further explain to everyone what is this all about. Okay, over to
Okay.
Ben. You. Yeah.
Okay, so thank you, Chen Yi. So as Chen Yi says, this round we are covering women's health. Okay, and today we are covering incontinence. Incontinence, which is also quite commonly seen in women's health as well as guys. Okay, so okay, but anyway, if you have a girls' friends or best friend forever, ladies, females, mom, okay, do tag them in. Okay, because this is a very rare topic. It's a very rare topic, and a lot of people feel shy to face it. And today we are here to share with everyone. I will expose my something, okay, to let everyone see, okay, learn something. Okay, so yep, next. So okay, guys and women, men and women. So actually, we are the same. So although today's the topic, we call it women's health. All right. But we don't want to target it to women only. Okay, guys, look here. Okay, you're also one of our target here, or the audience that we are looking at. Because why? Guys also suffers the same thing as incontinence. Okay, but guys may not suffer incontinence as much as what Chen Yi say lor. So frequent. But guys will present with another thing which we call it sexual dysfunction. Okay, so guys, you may not have incontinence, but if you have some what do you call it, sexual dysfunction problem, okay, or something that you want to improve your performance, this is where you can comes in. Okay, so just a summary: urinary incontinence isn't a disease. Okay, it's not a disease. Okay, it's not an uncurable disease. It's just a symptom. It's just a symptom that we need to look into, and something can be done. Okay, and today we have two professional, right, medically. One is from TCM, traditional Chinese medicine. One is from Western, which is a physio. Okay, to share with everyone about incontinence. Okay, so basically, when we talk about incontinence, we need to know about one thing first. So what we are looking about, we are looking at something called pelvic floor muscle. Okay, in short, we call it PFM, pelvic floor muscle. Okay, so we need to know, okay, incontinence is due to the weakness of a pelvic floor muscle. Okay, and but of course we need to know where is pelvic floor muscle lor. So from our diagram here, right, so you can see what is the function of pelvic floor muscle. So it's meant to support our bladder. On your screen on your left, yes, there is a guy's anatomy. On your right is a female's anatomy. Both guy and female or man and women has bladder. So pelvic floor is meant to support our bladder. Okay, so now next slide. So next slide explains pelvic floor is there to support our bowel. Okay, guys and men and female, you need to pangsai, isn't it? So when you need to pangsai, that's where your bowels works. Okay, and you need your pelvic floor to hold your side. Otherwise, it will come out from the custom very fast. Okay, and thirdly, what does the pelvic floor do? Thirdly, pelvic floor, okay, this is the special about women. Your pelvic floor is there to support your uterus and vagina. That's why if you hear, right, a lot of auntie always says, "Ayo, I feel like something is coming out from my private part." All right, and they may not want to tell you, or they may want to share with you. Okay, what is something coming out from the private part? Sometimes it could be vagina, sometimes it could be their uterus. Okay, especially those our old aunties, right? They have a multiple childbirth one. Okay, they don't give birth one or two one. They give one dozen or 2 dozen one. Okay, of kids. So that's where they easily have this kind of vagina or uterus coming out from their the vagina area. Okay, so from this, basically we have an idea. What does pelvic floor do? So they are the floor. So they are the floor inside the pelvic to support our important organs, which are bladder, bowels, and uterus. Okay, so why today do we give the name women's health? Because women's got special thing, uterus and vagina, to talk about more. Okay, and okay, next. So now go back to incontinence. When we refer to incontinence, a lot of people thought it's just urine. So actually it's not. It's okay, it's also your bladder control, your bowel control, your vagina, or your uterus. Okay, is there any other things that can fall out from their area? I think no more lah, huh? So basically these are the 3 things. Okay, and a lot of people thought that it would be more often as the people get older. Okay, so our 2 dear ladies, have you all have this already? Okay, so just kidding. All right, actually it is not. Okay, so here BENPHYSIO assure you that this is not an inevitable consequence of aging. So that means what? It is curable. Okay, it is curable, it is treatable, and it is repairable. All right, and it's a lot of time because of the weakness of the pelvic floor. Okay, and core strength. So remember, our words is a weakness of your pelvic floor. Okay, so therefore today our treatment will cover your pelvic floor to make it more stronger. So guys who have the performance, who wants to improve your performance, look here, see here, tag them. If you know they have the problem, tag them. Okay, so yep, that is about incontinence. Okay, so next we will share what is the cause, right, or what are the risks of incontinence in women, or what type of women will have incontinence. Okay, so we look at this picture. So most likely this picture will tell us most already, whereby you have a previous incontinence before, you have a multiple pregnancy, or you have a previous pregnancy. Okay, and then some vaginal usage, forceps usage during delivery. Okay, or injuries during delivery. Okay, now this injuries refers to like, for example, sometimes you want do operation to remove your uterus, okay, or operation to repair your uterus, endometrium, all this, and then excess weight. So all this put you on the risk of having incontinence. Okay, so therefore I think our TCM Kim, right, today you will share with us about some diet, isn't it?
Yes.
Yes. Okay, so those who have excess weight one, and you do have some incontinence, you look here a little bit. Okay, so what are the other risks? Okay, as everyone knows, right, there are certain drinks or food or medication, okay, will also increase your bladder flow. Okay, and therefore it will stimulate your bladder. Okay, so so these are some other medications. All right, and alcohol also caffeine. So those who drink a lot, okay, they also may drink a lot of coffee. They always go for toilet more often possible. Carbonated drinks, sparkling. Okay, now the reason why we have this slide is very simple. Okay, remember, when you have incontinence, it may not be your problem. It could be all this list. Okay, maybe Kim likes to drink coffee every day, 5 cups a day. So that makes her always go for toilet, possible one. Okay, or history of abs. Abs means abdominal operation. Okay, those who always have operation in their abs, they often have incontinence. Okay, and very often, right, in hospital after the surgery, they may not refer to physio, or if they referred to physio, the physio may not or forgot to teach, okay, some pelvic floor exercise. All right, so that's where they carry it forward, no? And some other causes like prostate enlargement in guys, prostate cancer, neurological problems like stroke patients, Parkinson's, they also often have this incontinence. Okay, so these are the incontinence, caused incontinence from a Western point of view. Okay.
Yeah, so what about in TCM point of view? Yeah, so maybe Kim can tell us a little bit more from a different side of the explanation.
Yeah, sure. As Ben has mentioned earlier, I will continue listing down the causes of incontinence from traditional Chinese medicine point of view. Emotional disorders such as anxiety will also lead to incontinence. Majority of patients who have anxiety or depression suffer from incontinence. But in Chinese medicine, we call it qi stagnation. So qi stagnation works rather like a roadblock. Next slide. Roadblock or a traffic jam. All the frustration, tension, hindrance, and stress can lead to incontinence. Okay, moving on. Some sub-healthy patients also suffer from incontinence. Sub-healthy, also known as 亚健康 in Mandarin, refers to patients who are generally healthy. Everything in their blood record shows normality, but somehow possess some kind of discomfort. So sub-healthy patients who have incontinence normally present with qi deficiency or dampness. Qi deficiency actually means lacking in an essential constituent in the body. For example, a punctured tire, like you can see in the picture here, can still be used for a couple of miles, but it will put strain on the vehicle, right? Same goes to our body. We will start straining our organs with the lack of qi, and then on the long run, stresses different and multiple organs, which will cause the lowering of immune system, this and that. Yeah, and moving on. In Chinese medicine, dampness is a condition where fluid in our body is not metabolized ideally. Dampness is known as also pei. You all know subpei, right? Heard of subpei, right?
Heard of it, but I'm not so sure about how to explain it.
So subpei, sometimes in patients, you tend to have symptoms like extremely low or no vibe, no drive, heaviness, laziness, or moodless. It's a very heavy, a very lazy kind of symptom. Yeah.
I think one of the drive also includes sexual drive.
Oh, yes.
Yeah.
Correct.
Okay, sexual drive. Yes. So you don't like. I mean, you don't have the sexual drive. Sometimes also because of this, right?
Yes. Correct. Right.
Yes.
You're right.
And can you treat it, right? See you. Yes. That's why you're here.
Okay, moving on.
So maybe that is about the cause. So what about the symptoms, right? I mean, like maybe Ben can tell us a little bit.
Okay. Okay, so basically, now these slides we'll talk about more on the urinary incontinence because this is more often and can be seen easily. Okay, some people always tells me, oh, I slightly little bit I leak already. When I stress out, I do something, carry something weight, I leak a little bit, 1 titik or 2 titik. And then I want to go to bathroom and suddenly I cannot catch on time. Yeah, so a little bit of leakage. Or suddenly I want to go toilet and just suddenly it leak. Okay, too fast. It leak too fast. Okay, without your control. So all these are small little leakage. All right. Or some people after sneeze and simple cough, right, they also have a little bit of leakage. So all these are the signs of urinary incontinence. So you may ask me, hey, then how about bowel incontinence? Let's put it this way, very, very, very rare people have a bowel incontinence until sneeze and cough, then leak a little bit of the side out. It's a very, very rare. Normally it's a urine. because urine a little bit difficult to control, to hold compared to the shit. Okay, yeah. So therefore, over here, we use the symptoms of urinary incontinence. But again, go back to our slide just now. Incontinence refer to three things: bladder, bowel, and also your uterus and vagina. Okay. So next one.
So then when it comes to treatments, right, what can both physiotherapies and TCM do in this case?
Okay. So we will start with
TCM?
CCM. Okay.
Yeah, so how can Chinese medicine help with urinary incontinence? In Chinese medicine, we provide a few treatments, such as prescription of herbs, herbal therapy, acupuncture, acupoint therapy, massage, also known as tuina, and diet therapy to treat urinary incontinence or any incontinence, all right? After asking you a series of questions, your physician will check your tongue and you'll take a pulse, and then you'll decide on where to work, either your qi stagnation or your qi deficiency or dampness, or maybe something which is even more severe that we need to look into. All right, next slide. Yeah, do take note that Chinese medicine can also help with these causes of incontinence. Take for example, Chinese medicine can help with patients presenting with incontinence after childbirth. First, patients will be examined by physicians, and then we will advise our patients to actually go on herbs or acupuncture for a period of time, depending on the severity of the incontinence. Yeah.
Understand. So then what can the patient or whoever have then, what can they do from home? So guys, before Kim further explain to us, please class 1 if you are here, so then we know that you are here, okay? So please do that for us. Yeah,
And
over
also
to
tag your
Kim.
friends, female
Yes.
friends, ladies,
Yes.
mommy, potential mommy,
Yeah, because
auntie.
because we are
Yeah.
about to
So,
mention the key
hello?
point here. Yeah, because we are going to mention about the key point. So take note over here, okay? We're going to have questions.
Yes.
Okay. So
Okay.
So in Chinese medicine, there are actually a few practices that you can start doing at home to help with incontinence or to even prevent this condition from happening. Right. First, you need to soak a hot towel and place it on your lower abdomen below your umbilicus and apply pressure for 10 minutes on these acupoints mentioned. First is Qi Hai, which is also known as CV6. It is 2 fingers below the umbilicus, followed by Guan Yuan CV4, which is 4 fingers below the umbilicus. Right, these are the acupoints that will help in incontinence. And then also
Sorry, Kim.
Yes.
Don't mind one more round. The one can repeat one more time.
Yeah, speak slower.
Okay.
So if you want, I can become your demo. I can sacrifice my umbilical. Okay.
Yeah. So
Wait lah, so fast you show the video already. Can see, yeah?
Yeah.
Okay, go.
Okay, so there are few practices that you can do at home, all right, to actually solve this incontinence or even prevent this from happening, all right. First, you can soak a hot towel, and then Ben, can you show us your umbilicus?
Yes, here.
Yeah. So these 2 acupoints are located below the umbilicus. The first one is CV6, which is Qi Hai. It is 2 fingers. 2 fingers.
2 fingers.
Below
Yes.
your umbilicus.
So 2 fingers, which is here.
All right. So with the hot towel, you apply pressure, all right, on that point, and then following that will be CV4. Apply again pressure on CV4, 4 fingers below your umbilicus.
4 fingers. Okay,
Yes.
4 fingers. 1, 2, 3, 4. Okay, 4 fingers.
Can you tilt your camera lower so they can
Okay.
see? Yes.
Okay, so this one is 4 fingers, huh? 4 fingers.
Yes.
4 fingers. Okay, so 2 fingers. 1, 2, 2 finger. And then
Correct.
1, 2, 3, 4. 4 fingers a bit lower here.
Correct.
Correct, huh? Okay.
Yeah.
Okay.
Okay.
So 2 fingers under and 4 fingers.
Thank you so much.
Thank you for your
Yeah.
belly.
For belly. Yeah.
Okay.
Okay.
Moving
So
on,
that, so that
uh-huh.
so that's the other one, right? On the leg.
Correct. There's one more acupoint on the leg. It's this extremely famous. Anybody in the market in Chijongkai can tell you this point. It's called Zusan Li. Yeah, it's actually a very effective point in replenishing qi in the body. It's called Zusan Li.
Okay.
Very
Okay.
precise. It's
So Ben
actually
gonna show your leg.
I don't know whether I can reach. Okay, go.
okay. It's actually 3 fingers below the kneecap. Can I find your kneecap?
Kneecap. Okay, kneecap is here.
3 fingers below
3
your
fingers below. Okay. So on top here.
The outer side of the
Outer.
bone.
I
Yes.
understand. 3 fingers below the kneecap and
Yes.
go to outer.
Yeah.
Here. Okay.
Higher up a bit.
Higher about a bit.
Okay.
Correct? Or
A bit
here?
near. Yes, there, perfect.
Okay, got it. It's not on the bone, huh?
No, it's not on the bone. It's slightly.
Okay, got it. Okay, so I repeat underneath my kneecap, 3 fingers. And then from these 3 fingers, I draw all the way, okay, here.
What is
Yes.
the
Correct.
sensation like?
Okay. Sore. It's quite sore.
Oh,
Yeah, it's quite sore. So if those who are physio, you will know. There's a bone here. It's not on the bone. It's just on top of your bone. Yes. Okay. Can.
Amazing. Great.
Go.
right.
Okay.
Okay. So we'll
Yep.
touch on the leg now.
So then the next one will be on the foot.
Yeah.
Interesting.
So like, like what Ben mentioned earlier. Do you remember about the list of diuretics that Ben mentioned earlier?
Yes. Oops.
All right. And for those of you who are on medication that causes incontinence, do not stop medication on your own, but seek advice from your doctors. All right. In Chinese medicine, we normally advise patients to avoid food that are cold in nature, such as raw and uncooked food, salad, whatever, salmon, uncooked. All right, coconut, pineapple, and also watermelon. So these are the things that you should avoid if you are having incontinence.
Interesting. Now, before we move on to the physio part, right? There is one question from Amy Chang. She's saying that her the incontinence is only obvious at night, and daytime she is okay. So, what do you think is the cause to it?
Okay, like we have mentioned earlier, Amy, thank you for your question. Like we mentioned earlier, we need to really be careful with our diet. Like what we mentioned, to avoid caffeinated drinks and also
Yes.
salad, raw uncooked food, and then we would suggest you to come in to our clinic so we can actually screen you fully before we actually prescribe any herbal treatment or acupuncture for you. Yeah, most importantly, your diet.
Yeah.
So
So
it's
I
still-
agree with Zuki. Yes, it's a lot more related to the drink that you take before sleep. Like some people, they are okay to take coffee before sleep. And if you know, coffee contains caffeine. Okay, and caffeine can stimulate your urinary during your sleep time. Or some people like to take tea. There are some tea you also come with caffeine. Yeah. Or some people like to have what called sparkling juice before sleep. Yeah, or wine before sleep. Okay. Now normally scientists encourage us a little bit of wine. Okay. Some people more changi, but they want a full cup of wine, also possible. All this still can stimulate us what called urine at night. So now again to Amy, right, over here when we talk about incontinence, right, it has to be a little bit of leakage. It has to be a little bit of leakage. Okay, so if you are those more obvious at night and it's not a leakage, so we may not call it incontinence yet. So that one you just call it as more urinary more often. So we just want to make it's a little bit different. All right, but again, if urinary more often, also another problem. It could be also diabetic, signs of diabetic. Okay, so yeah, so all this is still, I think, is still related to a dietary. Yes.
Just like don't drink too much of water before you.
Yes. Okay.
So that is just on the TCM side. Now, maybe Ben can explain to us or show us what sort of the exercise that physio can actually demonstrate, and also you know, the audience can do at home. Yeah.
So Zukim, you will demonstrate. Just now I demonstrate for you. Now your turn. Okay, just kidding. Okay, so I think everyone knows, right? When we want to strengthen our pelvic floor muscles, okay, the most key exercise is called Kegel exercise. All right, everyone, you can Google Kegel exercise or pelvic floor exercise. Definitely, you'll get a lot of exercise. Okay, about Kegel. Now, only one key. Okay, you must only learn one important one, which is Kegel. So Kegel is meant for pelvic floor. All right, now before we proceed, right, first you must know where is your pelvic floor first, isn't it? Okay. So okay, next slide. So before we start, right, number one, you have to know where is your pelvic floor. So everyone, where is your pelvic floor? The most easiest to feel is your pelvic floor is underneath you. Underneath. You cannot see. Okay, pelvic floor is underneath. Okay, around here we call it pelvic floor. All right, and now go back to the slide again. So now before you start this exercise, right, first thing, make sure your bladder is empty one. Okay, make sure your bladder is empty, otherwise the urine will come out. Okay, bowel I think should be okay lah. As I said, bowel not that easy to leak out lah, but bladder yes. Okay, make sure it's empty, and then either you are seated or you are lying down. Okay, now number two, what you try to do is now tighten your pelvic floor muscle. Okay, tighten your pelvic floor muscle. What is tighten? Tighten means, right, imagine you are trying to let go to urine and you suddenly hold your urine. Okay, everyone try to hold your urine. Okay, this is what we call tighten your pelvic floor muscle. Okay, hold your urine. If you're good enough, hold for 3 seconds. 1, 2, 3, and then let go. Okay, so hold your urine. 1, 2, 3, and then let go. Now, how you know if you're doing correctly or not? Okay, how you know if you're doing correctly or not? You can even put your hand underneath, okay, and feel, tighten. Okay, you will feel a little bit of contraction one. Okay, so this is correct, what we say correct lah. So you tighten the correct muscle, which is what we call pelvic floor muscle. All right, and hold it for 3 seconds or 5 seconds. Okay, now some people, okay, after that relax and then do again. Okay, 3 to 5 seconds. Okay, now pelvic floor muscles is a very sensitive muscle. It's a very sexy muscle. Okay, you cannot work them too long. You cannot overwork them. Okay, now over here we just recommend repeat 10 times, and 10 times a day is enough. Okay, now for example, I'm now doing my presentation. So while I'm doing my presentation, I just hold it for a while for 3 to 5 seconds. Okay, then I let go. All right, and then I do again, just 10 times. That's sufficient already. Okay, because these muscles fatigue very fast, especially when you are very weak. Okay, so you don't overdo. If you feel like, hey, after 5 times I squeeze, right, hey, I feel like no more strength. Okay, you stop at 5. Okay, otherwise you can go to 10 times. All right, and then we can do it as frequent as 10 times a day. Okay, this morning I saw Chen Yi, I scolded her. I squeezed my pelvic floor and I scold her. Okay, then after that I see Kim. Okay, I want to shake hand with her. I squeeze and then I shake hand with her. So by doing this, right, it's already 10 times a day you can do. Okay, and the speed again. Yes.
So Ben, you are trying to say that maybe like every 2 hours, just to repeat once.
Yes, it can be every 2 hours, squeeze once. Okay, while you are seated there, nothing to do, squeeze. All right, while you're seated there, listen to your phone, squeeze, or playing games, you squeeze. Make it anytime, anywhere. All right, and then most important, as we said, this muscle is a very sexy muscle. Okay, shy muscle. Okay, they fatigue, they tired very easy. All right, so therefore, don't do it too fast. So some people squeeze, let go, squeeze, let go, squeeze, let go. I tell you, that pelvic floor will tired first, and then maybe I tell you, you may incontinence first. Okay, so don't. So squeeze, okay, hold for 3 seconds and then let go. Okay, squeeze, hold for 3 seconds and then let go. Take it easy, relax. Okay, and progress. So you can progress with a slightly faster speed, okay, but not too fast. Okay, or you're comfortable with your own speed, that's good enough. Okay, and you also can progress with a higher reps. Reps means repetitions. Okay, you feel like, oh, 10 times is a bit too easy. Okay, you can go for 15. But as I said, these muscles tired very fast. Okay, you can feel yourself. Okay, and also duration. Every 2 hours, you can also make it every 1 hour. Okay, you just squeeze for 1 time, 2 times, 3 times, up to you. Oh, for me, I don't fix the formula. Most important, you know what are you trying to do. You hold your pelvic floor. You hold your urine. Okay, so this is how you start with your Kegel exercise. Just hold your pelvic floor, hold for 3 seconds or 5 seconds, and then let go and do again. Okay, so if you're lazy to see all these things, you can just watch what they call this Kegel exercise, this slide. Okay, keep this slide with you. Yes. Okay.
Okay,
And
so yeah, maybe Ben, you can tilt a little bit on your video so that we can see you clearer.
tilt me. Okay.
Yes. Okay.
Yes.
So then you're gonna bring us through how to do this, right?
Yes. Okay. So now I know how to squeeze already, right? So what else I can do? Whenever I want to sneeze or whenever I want to cough, I can squeeze my pelvic floor and cough a little bit. Okay, or I can squeeze my pelvic floor and sneeze. Hachi. All right. So especially for those who already have what they call leakage, this is what you can do for yourself. All right. Now, I also can have a little bit of squeeze when I try to lift something, or when I try to lift my grandchildren. Okay, when I try to do house chores, or when I exert force. Okay, this is what we call functional, or WFH. Do you know what is that stand for? Work from home. Nowadays, everyone work from home. WFH. Okay, not the bad word, nah. So it's a work from home. So now, if I work from home, right? Every time I sit down, when I want to lift my chair, I also can squeeze, and then I lift my chair and go away. Okay, so I can squeeze a little bit, hold for 3 seconds, and then I just stand out and lift. Also can. All right, this is what we call make it into functional. Okay, make it into your day. I think there's a question. Very big screen.
No, not yet.
Okay, so okay, yeah. So where am I? Okay, yeah, Kegel exercise. All right. Now, okay, before okay, Kegel exercise, right? Now, if you look at the YouTube or whatever, right, they will teach you a lot more. All right. So Kegel exercise is meant to strengthen the pelvic floor. But myself, like BENPHYSIO, okay, myself personally, I feel that we should not just do pelvic floor muscles exercise alone, because pelvic floor is a shy muscle, it's a small muscle and easily fatigue muscle. We encourage to do pelvic floor exercise together with your functional activity. Okay, for example, like what we say, when you try to cough, when you try to sneeze, when you try to get up from your car, when you try to get up from your chair. All right, so make it into functional. Okay, that's where you can subconsciously train your muscles a little bit. Okay. Yeah, I think I saw a question, right? How long one need to undergo treatment to see an improvement? You can see the question, right?
Yeah, I can see, but I think that question I can ask later on. I'll let you finish first.
Okay.
I'll let you finish first.
Okay. So that's my Kegel exercise part lah. You should not just exercise Kegel only, but you must make it into functional. Make it into your daily routine. If you're a boss and every day you scold your staff one, so every day you have to hold your pelvic floor and scold them. This is what you call you make it into function. Okay. So that's all my part.
So maybe we can also try to understand like what does one audience ask us the questions, how long it takes or what is the treatment durations to see improvement. So maybe any of you can help to answer these questions.
Ben, you want to go first?
Oh, okay. Okay, so sorry, what was the question? Or how long does it, okay, it depends. How long one need to undergo the treatment? Honestly, it really depends. Okay, now again, back to your incontinence, how bad they are. Okay, if your incontinence has been there for the past 5 years, 10 years, right? It takes some time. It takes some time because pelvic floor need to be trained back to have strength to hold your bladder and hold your urine. Okay, so therefore, but what I can assure that is if you can activate your pelvic floor and whenever you find that there is a leakage, if you can hold your pelvic floor, the leakage will minimize, definitely will minimize. Okay, yeah, but of course, because how long one undergo treatment, yeah, so it depends. Okay, but again, it's not about the treatment that matters. It's about whether you can you carry out this pelvic floor exercise in your daily routine. That matters more. Okay, so that's my part. So Kim, do you have any?
I think for Chinese medicine, again, like what Ben say, it has to be over a prolonged time, about 5-10 years or like a few years. And all this is accumulated. Sometimes qi deficiency, qi stagnation don't happen just overnight. So it has been there for a long period of time. So what we can do is that herbs and then acupuncture can actually fix whatever that has been there for a long time, and then somehow harmonize and rebalance everything in the body.
Yep.
Well, so okay, now I guess everyone will be, asking like how nice we can actually combine what physiotherapies can do for us together with TCM, like what Kim has explained, in one holistic solution. So, how is it going to happen? Is that a way that we can have these treatments, holistic treatments?
Yeah, we have a good news to share. Could we show the next slide? Yeah, so here in Yimura Medicare Center, we are offering an integrated therapy whereby you can get access to both Chinese medicine and physiotherapy, also known as the East meets West therapy. So over here in Yimura, healthcare professionals provide acupuncture, herbal therapy, physiotherapy treatments to actually with the intention to provide complete care for improvement and maintenance of health. Yeah.
Any things that Ben would like to add on?
In short, Imura is a combination of Eastern and Western when East meets the West. When BENPHYSIO meets the 1TCM, and this is our new baby, we call it Imura. Okay, so Imura is meant to treat people when you are not in pain. We look for young, healthy people to come in, to step in. Yeah. Okay, so that's in short lah. It's our new baby. So Imura actually is partially is because partially is consists of a BENPHYSIO actually, for everyone who are in front. Yep. Okay.
So then I also get to know that today's session, if we have to, anyone can, like you tag 3 friends, you answer to the questions, and you get a chance to win one treatment session, which is worth 268 ringgit. Now, so I'm so excited. Can any of you start sharing the questions so then our audience will be able to participate and win the free session?
Okay, what is that one acupuncture point? Just now we have shared 3, right? What is that one point? Just mention the name and also the spelling if you can. All right, the name of the acupoint and the spelling of the acupoint, and kindly answer what is the acupoint that can help in urinary incontinence.
So yeah, guys, do you remember what Ben has just demo? Just now the acupoint. Yeah, please, tell us your answer. One of the point, right, Kim? Just one of the points will do, right?
Hey, can we go back to the previous slides for reference? Yeah.
Previous slide, then we are telling the answer already. This one, that.
Yeah. Yes, CV6 and CV4. The answer is, I don't know.
Okay, so what other questions from Kim still? Any more from Kim before Ben is going to come up with his questions?
What is that one cause? I mentioned 3 causes of urinary incontinence in Chinese medicine. What is that one cause? You just have to tell me one. What is that one cause that will actually result in urinary incontinence?
One cause from TCM, yeah. So don't mix up with the one cause from BENPHYSIO. Okay. So now Ben, over to you. Do you have $1 million worth? No lah, 268 ringgit worth kind of question for the audience.
No, we just
Okay, so
we just stick back to that question. We'll do.
okay, we're gonna stick back. So now, guys, once you are able to tag your 3 friends and answer the question that Kim just mentioned, we're going to have a draw ballot, and then we were going to announce the 1 lucky winner for the free session like much later. Okay, not now, but then grab your opportunity. Quickly do it now before we end the session. Okay. So let's talk about, since today we already complete this urinary incontinence. So maybe we need to start talking about or sharing a preview to let everyone know what we're gonna cover next week. Yeah. So next week we're gonna have punch pain, and we will have different speaker again. But Ben is still with us. So for now, we'll just I'm not going to disclose who is the next speaker. We're going to tell you or introduce to you by next week.
Yes.
So to the audience, if you still have any questions to our speaker today, feel free to share your questions right now. We're going to end maybe in like 1 minute time.
Okay.
So in the meanwhile, so do we have any more advice from Kim or from Ben? Before I forget, by when the audience need to know that, hey, they need to come back to maybe come back to Himura, come back to Kim, or come back to Ben for treatments? Because I remember that usually women will drag for 6.5 years, then only come for treatments. But we know that nowadays we shouldn't be, especially after today's sharing. So yeah, over to you guys. What is your advice?
Practice make perfect.
Yeah, and prevention is better than cure. So even without the symptom, you can actually come in to get a screening from us, and then to actually realize what are you actually facing, and then we will definitely help you out.
Yeah, so especially I already put the contact number here. If you guys want to make appointment for consultation, feel free to WhatsApp to this number 011-1286-1383. All right, so just do give us a message or drop by to the outlet. We will have physios and TCM to be there and give you assessment and consultations. All right. So any questions from the floor so far? No, we don't have any more questions. So I guess that is all for today. So thank you very much for Ben and as well as Kim for sharing such a very interesting topic today with us.
Okay.
So,
thank you. Hey, thank you, Kim.
Thanks, Kim.
Okay.
Bye.
Okay. Bye-bye.